Dr. Douglas Wine for bluehonest.com, and today's topic is the difference between lasers and LEDs and light therapy devices. In today's world, there's an enormous amount of LEDs and light therapy devices that make claims for health and cosmetic results, and it's very difficult for you to decide whether you want one of those, whether they're valid or not valid, whether you're going to get results or not, right? So the difference between lasers and LEDs and light devices, light therapy devices, is categorized, and light is categorized, if you will, by what is called coherent versus non-coherent light. And what does that basically mean to you is one is very specific and controlled, and the other one is very scattered. So this coherent light is light that you can control. It's the wavelengths are controlled, the frequencies are controlled, the power is controlled, and they're very specific as far as what you can do with them. So for example, you could do surgery, LASIK surgery, for example, industrial cutting, engraving, things of that nature, which you have to be very, very precise. You would have to use coherent light, lasers, in order to achieve that. Now, you would certainly not want to use non-coherent light to try and do LASIK surgery, because it's not, so you're not going to be able to have anything that's very precise. It's very scattered light. So one of the other biggest differences is penetration. So do you want something to be able to actually get deep into we're talking about the human body as far as health or cosmetic results now. Do you want something that's very superficial? Or do you want something that can penetrate and actually regenerate tissues from the inside out? So coherent light can penetrate inches deep into the human body, and of course that means that you're going to be able to get deep into, and get to organs, glands, tissues, ligaments, muscles, tendons, discs, etc., etc. Where when you have scattered light, it has no penetration, or very to little, I should say. So you will be able to get into what's called the epidermis of the skin, which is the first layer of the skin, but it doesn't have the power nor the wavelengths to be able to get any deeper. So what does that mean to you? Do you want temporary results or do you want permanent results? And in order to get permanent results, there are specific things that have to be done. If you just want temporary results, there's some things out there now that you can use. You put these creams on your face and your wrinkles go away in 10 minutes, but an hour or two later, the wrinkles are back. So that's a very temporary solution. Do you want something that's permanent or, again, temporary? So let me explain a little bit more about how that works as far as science is concerned and the physiology of the human body. The human body regeneration chemical, and we're talking now health or cosmetic, don't care which one you're interested in, but you want things to be regenerated, all right? And regeneration also means permanent results, long-lasting results. If you want that, you have to regenerate the tissues, not temporary, but you have to regenerate. If you want to regenerate, you have to have specific wavelengths of things. So again, let me explain. The regeneration chemical in the human body is called adenosine triphosphate, ATP for short. It's kind of the buzzword these days. In order to produce ATP, your body has 4 enzymes that need to be activated. Those 4 enzymes, I actually have a chart right here to show you this. Those 4 enzymes are NADH, FADH, cytochrome C reductase, and cytochrome C oxidase. Now, those enzymes get activated by wavelengths from the sun. And they have to be specific wavelengths. You can see at the bottom which ones they tell you they are. The first complex, which is NADH, okay, gets activated by a 405 very specific wavelength from the sun, or from a coherent light, I should say. Where the second complex gets activated by a 470 and a 670, the third complex 520, 405, and the complex cytochrome C oxidase 670, 470, and 405. So the only way that you can get the regeneration chemical ATP produced is to have these 4 enzymes activated. Now, they have to be activated by specific wavelengths, and you can get that with coherent light. Non-coherent light, which is scattered. So non-coherent light covers multiple wavelengths. In other words, it will go anywhere from 400 to 500 or 450 to 550 or whatever. Very scattered light. So it has no specific wavelength that it actually communicates with, if you will. Which also means that it does not have any pulsed frequencies. You cannot incorporate a frequency into scattered light. Now, in the laser world and in coherent world, if you will, in order to have frequencies, they call it pulse light. So there's two types of waves, if you will, as far as light is concerned. There's what we call continuous wave and pulse wave. And so the pulse wave basically means that it's incorporated with frequencies. In order to have frequencies, you have to have coherent light. Scattered light, non-coherent light, you cannot incorporate frequencies. If you want results, it is a very well-known fact that anywhere from 10 to 1,000 times more precision, more results you're going to get with pulsed frequencies than you are with continuous wave. So and again, in order to incorporate the frequencies, you have to have coherent light. So lasers are the only ones that can do that. So if you want to activate the enzymes and you want to be able to dial the lasers in, the coherent light in, with the frequencies, again, you have to use that coherent light lasers. So the bottom line is this: if you want temporary results, you can get that with LEDs and light therapy devices. If you want permanent results and long-lasting results, you need to regenerate tissues from the inside out, and you need coherent light in order to be able to do that. Now, the only coherent light laser that is available today is a laser called the Blue Honest Pro VX laser that incorporates all of these frequencies to allow for permanent, long-lasting. Now, long-lasting also does not mean that it takes an eternity to happen. These things are very, very fast. If you use a laser today, that regeneration starts the second you use a laser. So these results are, although scattered light, you would think you're getting results very quick. They're temporary. You're also getting very quick results with a laser, but they're long lasting. So there again is the big difference. But not only that, but there's more wavelengths. So if you would like to know an example, there's 635 and 808 wavelengths, and they're phenomenal for pain and inflammation. So you can get regeneration and you can get pain and inflammation. There's a whole host of other things that can happen. If you would like to learn more about lasers, I've made a numerous amount of videos that explain all the details of lasers, the Pro VX versus other lasers. Again, this video is about lasers versus LEDs, and we have a whole video library. If you would like to watch some more videos and learn some more about lasers, and you want more information on simply just which one to buy, because there's quite a few devices available out there on the market today. So if you're interested in learning some of this stuff, please go to our library, bluehonest.com. And if you liked this video in particular, please hit the like button. That helps us out. And if you want more, you can hit the follow button, and you'll actually be able to get introduced to more of our videos that are available on YouTube. So please, thank you. Thank you so much for watching, and enjoy. Have a great day.